Hi there, my name's Brittany. I'm a bariatric surgery dietitian with WellSpan in the Chambersburg area. So today we're going to be talking about nutrition session number 7, which is going lean with protein. So let's talk about why protein is so important to us. So it's one of the 3 macronutrients that makes up total calories, protein probably being the most important of them after having bariatric surgery. So some reasons it's important are it is part of every cell and tissue in our body. It also aids in healing after bariatric surgery, which we know we want to make sure we have good wound healing. It does help to maintain lean muscle mass. So, of course, that's important because we want to maintain our muscle after surgery. The more muscle we have, the higher our metabolic rate. So we want to at least try to preserve the muscle mass that we do have. It does make you feel more full and satisfied with your meals, which that's a major goal of bariatric surgery to begin with. So this will help even more with that. It helps your body to fight illness and infection. So we know we want to be at our healthiest. And it improves hair, skin, and nail strength. So what are amino acids? They are known as the building blocks of protein. Individual amino acids combine in long chains to form intact proteins. There are thousands of different configurations or sequences of proteins. This unique sequence or code will determine the protein shape and function in your body. Now, an intact protein is made up of 20 different amino acids. Some of these are made by your body and others come from the foods that you eat. They're classified in 2 ways: non-essential, which means they're able to be made by your body, or essential, which means you can't make them in your body and you need to consume them from different food sources. The 9 essential amino acids, again, these are the ones that your body cannot make, so we need to eat them. Would be histidine, isoleucine, leucine, lysine, methionine, phenylalanine, threonine, tryptophan, and valine. Now, I'm not going to remember those, so I don't expect you to either, but they're just there for your reference, and they are very easy to look up if you had that question. Foods that contain all 9 essential amino acids. They're referred to as a complete protein. They're mainly in animal sources like beef, poultry, fish, eggs, and dairy products, just to name a few. They do come in some plant sources, such as soy, quinoa, and buckwheat. I do want to make you aware that animal sources are more easily absorbed than your plant sources. Foods that do not contain all 9 amino acids, but they do contain protein. So they're referred to as an incomplete protein. They mainly come in plant sources and are found in things like vegetables, nuts, seeds, beans, and some grains. Now here's a note for vegans. So a true vegan does not consume any animal products at all. So it is important for them to be especially careful about this. If you are a vegan, you'll need to make sure that you are consuming multiple different types of incomplete proteins to ensure that you get in all 9 essential amino acids on a daily basis. And you should definitely work with your dietitian on this. Make sure that you are getting in enough variety so that all the amino acids are being consumed. How much protein do I need after bariatric surgery? Excellent question. A minimum of 60 to 70 grams a day is recommended. Now, that doesn't necessarily mean that's it, that's all you need, but minimum. So your dietitian will talk to you individually at appointments if you need something different. So immediately following surgery, we know it's very tough to achieve this goal, to get in all 60 to 70 grams per day. So we just tell you, do your best. You're going to work up to that goal in the weeks after surgery. You want to make sure that you are eating foods in a specific order. So you always want to do your milk or dairy product first, vegetables second, and your fruit or starch last. Here's a chart with different high protein foods and their protein content as well as the serving size. So you do want to be very conscious of the serving size because we know that's going to have a major impact on how much protein is in the item you're consuming. You want to make sure that you are eating more protein-dense foods, meaning small volume, high protein content. especially in the first couple months after surgery because the volume you're able to eat at one time is very small. So, how do we calculate protein content? If the serving size is provided in ounces, that means they're referring to a weighted ounce. So you'll need to make sure you're weighing things like meat, poultry, fish, and cheese. If the serving size is provided in cups or something like tablespoons, you can use that to determine the serving size. Now, you always want to read food labels carefully, as individual products can vary widely. You do want to check to determine if they are referring to food in cooked or raw form. Now, mostly it's going to be in the form that you purchase it in, but occasionally they'll make a little note that says cooked. So be very conscious of that. Here's an example calculation. So if we weigh out 3 ounces of raw chicken, that's going to be equivalent to 21 grams of protein because it is 7 grams per ounce. And again, like I said, that could vary somewhat, so you always want to check the nutrition label if you have a nutrition label. It's recommended that you track your protein intake daily to ensure that you're getting in the total that you need per day. You do want to choose very lean or lean sources of protein. These contain 0 to 3 grams of fat per serving. Some examples are poultry without skin, that's not fried. Fish and shellfish, different cuts of beef, I'm not going to go into that, but they're listed. Some cuts of pork, again, lean pork. This does not include bacon. Veal, lamb, game, surprisingly, things like duck and pheasant are actually pretty lean sources of protein. And then there's also things like fat-free or low-fat cheese, egg whites, eggs or egg substitute like egg beaters, soy, beans, peas, and lentils. Now let's talk about high-fat sources of protein that are from animal products. So we know that high fat equates to much higher in calories. So we want to be very conscious of choosing lower fat alternatives. So much of the fat that is in animal products is in the form of saturated fat, which we know is really bad for us. It does things like clogging our arteries and can increase our risk for developing heart disease, stroke, and other medical conditions. These are some things to avoid. So fried meat. We know fried is a major thing to avoid because it adds in so much excess fat, and it's not a healthy fat. Poultry with skin, so think things like wings. Hot dogs, they are more fat than protein, unfortunately. Different high-fat lunch meats, whole milk dairy products, so think like regular cheese, whole milk, full-fat yogurt. Those are things that we really want to watch out for and avoid or limit as much as possible. So now let's compare lean versus high-fat sources of protein. So I chose lean ground beef in 93% versus 80% in a 4-ounce serving. So you can see, first off, the calories are different by over 100 calories. Now, that's actually a lot after having bariatric surgery. 100 calories can make or break you sometimes. Beyond that, let's look at the total fat. So we've got 8 grams of fat versus 23 grams, which is pretty significant in difference. In terms of saturated fat, that's again where we want to look. So 3 grams versus 9 grams, that's a 6-gram difference right there with a single, probably hamburger patty or a single serving of what you're going to be eating. Per the dietary guidelines for Americans, they recommend consuming a max of 10% of your calorie needs from saturated fat max. So let's say you're on a 1,500 calorie diet, or that's what we're recommending to you. That would be 15 grams of saturated fat per day max. And you can see with this 80% lean ground beef, you're already getting 9 grams of that for the day. So it adds up very quickly. Also, high-fat sources of protein from plants or plant-based fats. We know they're definitely a little bit healthier for you as long as we are not consuming them in excess. Now, they do contain less saturated fat and more of the healthy fats like your poly and monounsaturated fats. They are, however, still very high in calories and total fat and do not provide a whole lot of protein in terms of the volume you're consuming. So you can have them in small quantities, but you do want to be very conscious of the serving size and how much of it you're eating because it will contribute significantly to your overall calorie intake. Let's do an example here. So looking at 2 tablespoons of peanut butter, you can see that that's 188 calories. So that's a good bit for 2 tablespoons because that is a small volume right there. It has 8 grams of protein. Again, your goal is 60 to 70 grams a day. So this is not giving you a whole lot of protein, but it is giving you a whole lot of calories. Now you can see the total fat is 16 grams. Only 3.3 grams of that is saturated. So again, what's left over there of that 16 grams is going to be poly and monounsaturated fats. So again, use these plant-based sources sparingly. How you prepare your food after bariatric surgery is also important. So with the cooking process, it's important to choose lower fat methods of cooking and making sure not to add things like a lot of butter, oil, margarine. So we want to choose leaner or cooking techniques that involve less of this. So things like baking, broiling, boiling, steaming, poaching, grilling, which is my favorite, pressure cooker, or air fryer, which a lot of people have started using air fryers and they really like them. So that may be a great alternative to deep frying something. Try air frying. Now, instead of using the butter, oil, or margarine, you can use something like PAM or low-fat cooking spray or very low-calorie cooking spray. If you are going to use things like oil, try to choose something like an olive oil or an avocado oil and use in very small quantities. It does add up quickly. In summary, protein is part of every cell and tissue in our body. It is vital that you consume enough protein after bariatric surgery to minimize your risk of developing malnutrition while you're losing weight rapidly. Your goal is to consume a minimum of 60 to 70 grams of protein a day. Protein can come from both animal and plant sources. To ensure that you consume enough protein, you should make sure you're weighing and measuring your foods, as well as tracking your protein intake daily. You do want to make sure that you're choosing lean sources of protein to maximize your protein intake without consuming excessive calories. Thank you so much for listening to this video.